Hypertension Awareness Series Episode 26, we learn about patient education. This is a very important episode for healthcare providers. You have made the diagnosis of hypertension. Now what? The conversation that starts after diagnosis is just as important as the prescription. And once you diagnose hypertension, your next step is not just writing the drug chart. It is a structured, guideline-directed patient education, and this is what will determine adherence, outcome, and long-term control. And here is the clinical conversation framework that every provider managing hypertension should follow. Number one, explain the diagnosis clearly and in simple terms. Tell the patient what hypertension is in simple terms. Explain the systolic, the top number, and the diastolic briefly. Emphasize that hypertension is often silent but dangerous if it is not controlled, and avoid using technical terms. Try to make it as simple as possible. Number two, communicate the risk. Personalize the risk. Hypertension causes stroke, kidney failure, heart failure. Link BP numbers to real life consequences. You can say this is not just a number. Even if you have no symptoms, it affects your brain, your heart, and your kidneys, and we are treating to prevent those complications. Number three, set BP targets. Give clear individualized targets, e.g., we will treat until we get to less than 130/80. Explain that control means protection. It's not just taking medication, it's taking and the BP is well controlled. You can say we are aiming for a controlled blood pressure reading so that we can prevent the complications, and this is your target. Number four, discuss lifestyle modification. This is very key. Talk about salt restriction, weight management, physical activity, alcohol reduction, smoking cessation, stress management, and sleep. You talk about lifestyle modification, and it should be practical. What can you start this week? How will you reduce your salt? When will you start exercise, and what to do? Number five, explain the medication plan. Why medication is needed, and you can say treatment is not just to lower numbers. It is to prevent stroke, heart failure, or even complications. Explain to them the drugs you are using and keep it simple, the dosing, the timing, and common side effects. For example, if you are starting amlodipine, you can say this drug will help lower your blood pressure. Some people may notice ankle swelling, but let us know if that happens. Don't stop the medication. The drug is taken once a day. So the drug and the side effects and how to take them. Number six, explain and emphasize adherence and continuity. Hypertension is a long-term condition. You do not stop medication when you feel well. Missed doses means uncontrolled pressure. So normalize lifelong care without discouraging the patient. So you can say medicines will work when taken consistently. Feeling well does not mean you are cured. Do not stop medication because BP has improved. The reason the BP has improved is because the treatment is working. Point 7, introduce home BP monitoring. Encourage the patient to get a validated BP machine. Teach the correct measurement technique and to keep a BP diary. Patients who monitor will know, and you have empowered your patient to take charge of your treatment. Point number 8, plan for follow-up. Always tell the patient when to return. Review the BP responses, to check for side effects, and to adjust treatment if needed. You can explain, we treat hypertension over time and not in one visit. And finally, give hope and partnership. Reassure, hypertension is common. Hypertension is controllable. Emphasize teamwork. Doctor plus the patient will lead to success. And you encourage questions and also follow up. Hypertension is common, it's manageable, it's controllable. Do you have any question? Let your patient know that with the right treatment, lifestyle, many people live long and healthy lives. We walk the journey together. Remember, patients don't fail treatment. It's the systems that fail with education. Do not just diagnose hypertension. Teach it, personalize it, and partner in controlling it. Don't just prescribe the medication, prescribe understanding, prescribe partnership, and prescribe long-term success. We want to empower our patients to take charge of their treatment. Let them know what hypertension is. Let them know what medications they are taking, what common side effects to expect, and empower them so that if they notice any side effect, if they get a bit of pedoedema, instead of stopping the medication, they are aware and they can come back. Empowered patients are able to manage their conditions well. They may go to a place where they are told to stop the medication because the BP is okay, but they will remember, my doctor told me not to stop the medication once the BP is well controlled. So let's not ignore patient education from the word go. As soon as the diagnosis is made, empower your patient. Many times we see a patient was diagnosed, you are put on a drug, amlodipine 5 OD, and then after a month the BP normalized. They stop medication. 5 years down the line, they come with a stroke. We failed that patient. We did not empower our patient. So let's empower our patient. Let's not ignore patient education. Throughout this series, I have ran a number of technical presentations for the healthcare providers. I will now shift to simplified discussions for the common mwananchi. And as always, Dr. Beatrice Muthui-Mutua, saving lives one heart at a time.